Good evening, gentlemen. Before you go to sleep tonight, before you turn off the lights, before you tell yourself, I'll deal with it later, let me ask you a question that every urologist asks, but most men avoid answering. What is your body trying to tell you at night? Because for men over 55, the most important warning signs of declining blood flow don't show up during the day. They show up after midnight. Most men dismiss them. They normalize them. They laugh them off as just getting older. But in my clinic, those nighttime signals are often the first and clearest warning that blood flow below the belt is weakening. I'm Dr. Rachel Ross, a board-certified urologist. And for over 15 years, I've worked with men who believed everything was fine until it wasn't. And almost every one of them ignored the same signal. During the day, your body is distracted. Stress hormones are high. Adrenaline masks symptoms. Caffeine keeps you moving. But at night, your body finally tells the truth. Blood pressure drops. The nervous system relaxes. Hormones shift into repair mode. And most importantly, nighttime is when healthy blood flow is tested. This is why doctors pay close attention to what happens during sleep. Because erections during sleep are not about desire. They are a circulation check. When blood flow is strong, the body naturally sends blood to the pelvic area during deep sleep. When blood flow is weak, that signal fades quietly. No pain, no alarm. Just absence. Let's be very clear. The signal is not just erectile difficulty during intimacy. It's what happens when you're asleep. Men tell me things like, I don't wake up the same way anymore. I sleep through the night without any sensation. I wake up to use the bathroom more, but feel flat. Mornings feel colder, heavier. Disconnected. Most men think this is hormonal. It's usually not. Most men think it's psychological. It rarely is. In reality, it's vascular. When nighttime blood flow declines, the body stops performing its natural circulation tests. And that is one of the earliest signs of endothelial dysfunction, the stiffening of blood vessels. After the age of 55, three things quietly happen. First, nitric oxide production drops. Nitric oxide is what tells blood vessels to relax and open. Second, inflammation increases. Inflamed vessels don't respond well to blood flow signals. Third, nighttime repair slows. That includes vascular repair. When these combine, blood no longer flows freely during rest. And the pelvic arteries, being smaller and more sensitive than heart arteries, are affected first. This is why urologists often detect circulation issues years before heart symptoms appear. The body whispers before it screams. Let me tell you about Michael, 58. Michael came in saying, Doc, I sleep fine. I just don't feel alive in the morning. He had no pain, no major illness. Blood tests looked normal. But when I asked him about nighttime signals, he paused. He said, I can't remember the last time my body reacted at night. That told me everything. We weren't dealing with hormones. We were dealing with blood flow. Many men wake up once or twice a night to urinate and assume it's the prostate. Sometimes it is, but often it's circulation. Poor blood flow causes fluid to pool in the legs during the day. At night, when you lie down, that fluid shifts back into circulation, forcing the kidneys to work. This is why nighttime urination often appears alongside declining pelvic blood flow. It's not random. It's systemic. This is important. Medication may create a response, but it does not fix circulation health. If blood vessels are stiff, inflamed, and nitric oxide is low, the body struggles to maintain natural nighttime blood flow. That's why many men tell me it works sometimes, but something still feels missing. That missing piece is vascular health. Here's what I teach my patients. Not pills, not extremes. Just biology. Step 1. Reduce evening inflammation. Heavy sugar, alcohol, and late caffeine tighten vessels. Step 2. Support nitric oxide before bed. This can include light magnesium-rich foods, small amounts of nitrate-rich vegetables, and anti-inflammatory drinks, like turmeric-based golden milk. Step 3. Calm the nervous system. Stress at night shuts down blood flow repair. slow breathing, low light consistency. Within weeks, many men notice warmth returning, responsiveness returning, morning confidence returning. Here's why this works. Nighttime is when blood vessels heal. When you support circulation at night, you don't just improve sleep, you restore function. The body remembers what to do when blood flow is allowed. Nighttime symptoms are not random. They are not weakness. They are not failure. They are messages. And ignoring them doesn't stop decline, it accelerates it. Listening to them gives you time to act. Tonight, notice your sleep signals, support calm circulation, reduce inflammatory habits. Give your blood vessels a chance to open. Do this consistently for 14 to 21 days. Most men feel the shift before the month ends. You don't lose vitality overnight. You lose it quietly while sleeping. But you can restore it the same way. By listening. By supporting circulation. By respecting the signals your body sends at night. This is Dr. Rachel Ross reminding you. Your body speaks softly before it speaks loudly. Pay attention.